Okay, so part 2 of the core connection series, we're gonna be now kicking on or activating the core musculature. So thinking mostly through that lower core, reviewing from part 1, when we take that inhale in, diaphragm drops down, pelvic floor drops down a little bit. And now, instead of just thinking of exhale softening, what we're gonna be doing is focusing on an exhale, gently pulling that back up just slightly. So we're inhaling, dropping that down, exhaling, kind of pulling that back up. And then remembering too that when we inhale, there's expansion forwards, backwards, sides. So all of those are expanding. So when we exhale, we're gonna be bringing those back in together towards each other just slightly. So if there's like a 0 to 10 scale of how much we're pulling those muscles on, we're at like a 3 or a 4, 5 max, halfway there. So it's just slight. If you feel like you really want to feel it, you could give a little bit more, but you might find that your other muscle groups want to really start to kick on the more that the more that you really try to feel everything. So let's try this laying down. If you need to, grab a pillow, it just helps prop you up a little bit more. Okay, so going back to find neutral pelvis. Again, sometimes I'll see people way tilted back, their glutes are already on. Let those glutes go. You can tip your pelvis forwards and backwards a little bit until you find the middle between those two. I should be able to slide a little bit underneath your low back so that there's natural curves in our spine. So we're just looking for that natural curve. So we're not flattening really far back here. So reviewing that inhale breath in, I'm inhaling, expanding into my back, sides, forward. And then exhale, just letting that go. And now we're gonna add. So on that exhale, and now what we're gonna be focusing on is a slight contraction actually of that pelvic floor. So sometimes I'll imagine that I'm zipping up a pair of pants that are a little bit too tight there. I'm like sucking through a smoothie through the vaginal opening. Sometimes I'll imagine I'm like just gently lifting a skittle or like some tissue paper. It's very gentle. I'm not trying to just force it and just squeeze everything or squeeze my legs. It's just very, again, we're at like a 3 or 4 max, maybe 5 out of 10. So on that exhale, we're gonna be focusing on finding that pelvic floor a little bit of a zip up, pulling in a skittle. And then as we do that, we're thinking of those hip bones coming in closer towards each other. That's activating that deep core system. So as I inhale in, expanding. As I exhale, a little bit of pelvic floor, a little bit of hip bones coming in towards each other. I'm still exhaling, and then let that go. So the longer you can allow yourself to exhale, the more you're gonna get your deep core system to activate. So one of the biggest things I'll see is just pull everything on really firmly. And sure, that might actually kick that muscle on too, but the longer you let yourself exhale, you'll be surprised the more that you'll be able to feel that deep core. So this is it in just kind of real time. Okay, I'm gonna do that again. So I'm inhaling in, belly back size. Long exhale, pelvic floor, core. Almost so much that you want to cough. So the cue there again is on that exhale, slight pelvic floor contraction, and then I think of those hip bones coming in gently towards each other. I'm not just sucking my belly button in towards the spine, kind of pulling this area in towards each other slightly as I do that. And I'm gonna let that go. And then see if you need to, take a normal breath in between. Practice that again where you're then thinking of that inhale, everything's expanding, exhale, pulling in and up slightly, 4, 5 max out of 10 that you're working on here. You're mostly focusing on that breath and just getting movement happening there. What we'll do next is we'll go on to kind of part 3 of that series, and we'll keep going with this.